All right, we are officially live. Hello, everyone. Thank you all for joining tonight. We have a special presentation tonight. I am Naima, the host. This is my sign name, and I am here with Shannon Duchesneau. My visual background is a clear white background. I'm wearing a black sweater. I'm in a pink chair, and I have a black table next to me. I am the founder of Deaf Mental Health Hub, and I am a licensed therapist. I'll bring it over to Sharon. Hello, everybody. My name is Sharon, and this is my sign name. I am a white woman with light hair, red glasses, and an orange sweater. I have a teal background. I am a deaf counselor from Deaf Counseling Center. Thank you, everyone, for joining us tonight. Welcome, everyone, to Community Care in Action. I'm really glad that everyone is here and you can see all of the resources that we can share in the community. This is really a safe place that we can learn different tools from everyone, and hopefully you can benefit. If not, that's okay. It might not be a benefit for you, but I think everyone should take a look. We have different people here that are going to share different resources and hopefully offer a few tools that you can take or not. It's up to you. Please share these tools within our platform. And thank you, Interpreter, for volunteering. Thank you, Zach, for showing up to interpret as well. So after my wrap up, I will send it off to Shannon. Sharon. Tonight, I will be talking about the vagus nerve reset. With tonight being Friday, it's really the perfect opportunity for all of us to practice after a long week of work. The vagus nerve is responsible for a lot of stress, and so hopefully we can clear some of that tonight. So there's a little bit of scientific background discussing what the vagus nerve is. The vagus nerve goes along the back of the neck as indicated here, and it connects to your brain all the way down to your intestines. It has to do with your heart and lungs. And vagus means wander. So there are two nerves that wander throughout the body. The vagus nerve really has a very important role in managing stress and helping you become calm. So for the parasympathetic nervous system, we've recently learned a new sign for it, as demonstrated here. Looking at the parasympathetic nervous system, whenever our body perceives a threat, we experience or perceive harm or danger within a situation, our body will then have a response, what we know as fight or flight. There's also freeze, and these are a few different responses that our brain has to any stimulus. And they're really sudden onset reactions to a possible threat. So we can become tense. Another part of the parasympathetic nervous system is to help you rest. Throughout your daily life, with eating habits, sleeping habits, and just normal healthy body habits, when you're gathering with friends, just in a normal way, the vagus nerve helps us become calm. But sometimes the vagus nerve in itself is not enough. We can become very anxious, and it's very hard to settle down. Stress traveling to calm is really tough. So I have a little technique to help us, and we can practice some exercise together to help become calm. We would like to build a higher vagus tone. And I know this sounds like a little bit of science, but hopefully this will help you understand how we can apply it. Vagus tone isn't necessarily related to vagus tone is related to the medical term relating to our spine to help us with all our different body reactions. So hopefully, if we can reset the nerve, it'll help reset deep stress. So we're going to start with an exhalation. And if it's longer than an inhalation, it really helps you become calm. You'll probably see some hyper exhalation, but that isn't something you need to worry about. Just make sure breathing a little bit longer than normal is what's required. So we're going to use the 4, 7, 8, 2 technique, and that's going to start corresponding to breathing out and breathing in. So this technique is going to help with our vagus nerve. So we're going to start out by breathing out longer. So it's interesting that this is all about breath, right? Yes. So I know that sometimes we're supposed to breathe in, breathe hold, breathe out and hold, but we're supposed to breathe out longer than breathing in. That's interesting. Yeah, so sometimes when we breathe in, it can make people a little dizzy and lightheaded. Let me slow down. I just want to make sure that we're breathing out a little bit longer than breathing in. It's a short technique and we don't want to cause any pain. Just stay comfortable. So we want to follow what's ever best for your body. So with this deep breathing, another thing that helps us reset is splashing cold water on our face. That'll really help us calm down a little bit. If you have some cold water in a bowl and then you shove your face in there, if you've ever heard of a cold plunge, it's a very popular technique now. Sometimes you can go all the way in the cold plunge. Research does suggest that it's very important to help with stress. But male and female bodies are a little different biologically, which means that our biological stimulus within our bodies to cold water is different. With women on their menstrual cycles, that cold plunge might become a little bit different during your period. So for women's thyroid function, there's a lot of research that suggests that the vagal nerve has an important role to play. So you might not feel good if you're having a lot of stress in relation to the vagus nerve. So we want everyone to relax. Another technique to help is with walking. This can be dancing, doing some repetitive motion. Really, a lot of things with movement help us reset our vagus nerve. Oh. Meditation does help. Laughing does help. If you have some stress and then you see a funny movie and you laugh, science does show that it helps us calm down. It helps us reset our vagus nerve as well. Anytime that you do any of these things, you should feel good afterwards. But it's important to try and practice this regularly so that we can build our strong vagal tone. And that helps you switch your stress, sometimes becoming overwhelmed, to help calm yourself. And if you have a low tone, That means that when you develop stress, very prolonged amount of time at work, it's harder to become calm. That can also affect your attention. So that's with a low vagus tone, but we can work to improve that. So we always think about our physical health, but our mental health is affected too by breathing, doing exercise. All of this is related. It can improve our immune system, our vagus nerve. Everything's connected, our physical and our mental health. So tonight, I would like to do a little demonstration, and I hope you all follow me. Oh, you're frozen. You're frozen. Can you show the demonstration? Sure, I'll show you all how that you can do this at home. And this is what we call a vagal reset. And you can do this anywhere. You can do this out in public if you'd like. You may look a little bit funny, but that's okay. So the more that you practice, the stronger you'll get with your vagus tone. So I'm going to explain a little bit what this process is going to look like, and then you can all join in and follow me. It might feel a little bit awkward at first, but I'll really try and do my best to explain. So here's the main concept. First, what you're going to do is while you're sitting comfortably, before we start, I'd like to ask you that when you officially start, I want you to pay attention to how you feel when you're moving your head from side to side. So when you move your head left or right, hold it for a few seconds. So then we're going to start by interlocking our fingers with our palms out and then going behind our neck and placing our thumbs on the vagal nerve, as you can see here. And make sure to hold that. After that, we're going to stretch to the side. Make sure that you're in a comfortable position, not overexerting yourself. If you do feel any pain or discomfort while doing this exercise, you can go back to the standard position. While we're bending over, I'd like us to look up to the ceiling. So as you can see me, I'm bending left a little bit, and I'm looking right towards the sky. I'm holding that for 20 to 30 seconds. Afterwards, we're going to do a little yawn. So we're going to intend this to be a fake yawn, but it might become real after a little bit. A yawn or a sigh works. The yawn is connected to your vagus nerve. So what I really mean is that you should yawn as you're coming up and then go to the opposite side. So now we're going to be looking at the left ceiling, and hold this again for 20 to 30 seconds. And another yawn. And then we're going to do a test how we feel with our head left and right, okay? So I'd like you to count 20 to 30 seconds yourself and go ahead and follow and see how you feel. So the first test is looking to your left. Now to your right. Okay. Okay. Are we ready? Let's put our fingers together behind the back, thumbs on the vagus nerve. All right, lean to your left, look up to your right. And now the yawn as we come back to our neutral position. Now for the opposite direction. And a yawn, and back to center. Now again, we're going to look to our left and hold. Now look to our right and hold. And to back center. Now you get the idea. How do you feel looking left and right? Is it the same as before the reset or after? I definitely feel a little bit in my shoulders, but now it's a little bit reduced. Tiny bit. Of course, I do feel that there's some people watching me, but that's fine. I can do it alone in private next time. But thank you for setting this. And I noticed that I did have a difference and how my stress is a little different. But in a public place, I might feel a little bit more stressed than outside. Of course, of course. So, everyone, try to remember that you have to incorporate the physical aspects of this exercise to reduce stress. It's important to look left, look right all the way. I can't remember the name right now. It's a occipital nerve and it's related to your sight, and the vagal nerve could be connected a little bit. Oh, thank you so much for sharing, Sharon. I'm going to be trying that too. I hope that you all try it on your own time as well. Something nice and simple. So thank you for sharing that with us. It's pretty easy for me to remember, especially if you can just do it for 2 to 3 minutes. So remember that the vagus nerve takes in stimulus, and when we reset it, it can be treatment for even epilepsy. So some people with depression, even this can help reduce some depression and anxiety. So this is depression resistant, this pressure. So when we work on this with the brain over time, we develop those impulses and we build a stronger vagal nerve tone. This is really important and it's really impactful. So some of this is based, I know how to describe some of these concepts a little better than others, but you get the idea. But please stay comfortable, keep up with it, and keep investing in yourself. It's really the best. So make sure that you make the time to keep this up. Yes, it's really important to take a moment, pause, and get away from the phone or the news and everything that's going on. It's really important to take a break from that. And this something as simple as this is really a good idea to help keep your physical and mental health important. This is a really simple breathing technique that you can focus on having a pause and focus on your attention. You can focus on your body a little bit more. Do I feel tense or do I feel calm? Maybe we might need to focus a little more breathing techniques every day. That might help if you're feeling more tense. Great advice, Nyla. Thank you, Sharon. Thank you for coming tonight. I really appreciate this time with you. Thank you, community. I will be posting captions soon, and then people can view this later. So if you're going to post this in your videos, please make sure you use captions. Thank you, everyone. Have a great Friday. And we have 2 more lives after this. So stay tuned. Bye, everybody. Have a great night.